Good morning. I'm retired Air Force Lieutenant Colonel Jeff Anderson. Coincidentally, I'm the father of Dr. Reagan Anderson, who has just written a book on death care in America. And we're here to talk about that book to give you some insight, some behind the scenes views, and to get a little better read on what Reagan really is in terms of his book.
Yeah. Well, Dad, thank you for helping me throughout the book, helping me throughout life. And I'm really hoping that this segment can kind of help give people a little bit more insight and round out the book. So,
well, good.
Let's. This is the introduction. So, what question do you want to ask on the introduction?
Well, before getting into the book itself, I'd like to ask a few questions about you, so listeners can get an idea of you as a man, so that when they're reading the book, they have a better insight into your thought processes. So I guess the first thing to say is I never thought you'd be the boy that would join the military, let alone Marine Special Forces as a combat doctor. So what possessed you to do that?
You know, I joined the military to pay for medical school, because medical school is enormously expensive, which is one of the problems that we're facing in healthcare right now, is that when physicians are done with medical school, they're under a huge burden of debt. And I didn't want that debt. I also wanted to serve my country. And at that time, I had just left seminary. So I was really more of a conditional pacifist, which means that I wanted to find the solution to a problem in a peaceful manner as often as possible, and before the violent or the aggressive path was chosen. So I went to medical school under a Navy scholarship to help pay for medical school. I was able to serve my country at the same time, and plus I was able to experience the other side of the coin of conditional pacifism.
Well, I know that the Marines don't really have their own medical corps, that they rely on Navy for that. So again, I'm curious how you went from a Navy scholarship into supporting Marine Special Forces.
So after the first year of medical school is over, called internship, that's where you're a doctor but you don't know anything. I was at Naval Hospital Camp Pendleton, and I completed that internship year. And then I applied to become a dive medical officer. And the dive medical officers for the Navy, they are the physicians who take care of the special forces in the Navy and Marine Corps, because like you said, the Marine Corps does not have their own physicians. So I went to dive medical officer school, and I graduated as its valedictorian. And most of the assignments for our class in dive school were to like Navy SEALs or explosive ordnance disposal or nuclear subs. The only position where it was going to war was with Marine Recon. And I was best suited in my entire class to do that. One, I was single. Two, I had the right mindset and the right physical conditioning to be able to do it. And I wanted to challenge myself. And I wanted to be with the toughest of the tough. I mean, at that time, Marine Recon, they were the quasi-special forces of the Marine Corps. And we got all the worst assignments, all the most dangerous assignments, anything that was too long or too hard or too out in the boonies for the SEALs or the other special forces units they gave to Recon. And so we got all the toughest assignments. And I wanted to challenge myself. And so I went.
Well, you certainly did challenge yourself. When you told me you had volunteered for Recon, I wasn't sure that you really knew what Recon really was, but I did, because I had supported them in my Air Force career. And the thought that occurred to me was that you would learn more about being a doctor and learn more about yourself, assuming that you would go to combat, which I assumed you would as Marine Recon. You would learn more about medicine and about yourself in a short period of time than you would perhaps learn any other way in life. And so I'm wondering if you could speak to that.
You know, I think a lot of experiences in life, you don't really know what you're signing up for until a couple years after it's over and you have had time to process. Yeah, I had no idea what Marine Recon was. And when I was interviewing for the position, I knew that I would be heading straight to Fallujah, Iraq. And at that time, Fallujah was the worst part of Iraq. In fact, it was probably the worst part of Iraq for the entire engagement over there. And so I knew that that's where this assignment would take me. I had no idea what I was signing up for. I had no idea how it would shatter my world. I learned a ton. I became a ton. And it was hard. With everything that challenges us in life, we will grow. To think that you grow without challenge it's kind of a unicorn type of thought. It just doesn't exist. So I went and I was challenged. I was broken. And I think I came back stronger than I would have ever been otherwise, with more wisdom and insight than I would have ever otherwise. And it's the same with medicine. I had no idea what I was getting into when I went into medical school. None at all. You watch a couple of shows on TV and you think you know what medicine's about. No idea. And then when I was done with the military and done with my dermatology residency training and then out in clinic practice, I, again, had no idea what our patients went through on a day-to-day basis. And as this process has evolved from medical school to dive medical officer school to war to being a civilian dermatologist, it just really hit home that something has to change. Medicine right now is broken, it's fractured, it's enormously expensive. The rationing of care in America, I would argue, is worse than in any other developed nation on this planet, most of whom have universal health care, some form of it. And we in America, we think that because we have private insurance and all this stuff, it's not a quote unquote socialized system, that we have better care. We don't. We have worse medical outcomes on almost every measurable way that you can measure anything than all other developed nations. If we're not at the bottom, we're at the bottom half on almost everything, and yet our healthcare costs at least twice as much to deliver. And so all of these experiences, I had no idea what I was getting myself into. But they all have the commonality of after you've been in it, after you've been in the trenches, if you will, in Iraq, and if you will, in the trenches of delivering medical care in America, and as a veteran trying to get care from the VA, something has to give. And that's why I wrote this book.
Well, that leads me to my next question. The title of the book is Universal Death Care, a Solution for Healthcare in the Age of Entitlement. That's quite a daunting title. What do you really mean by that?
Well, the United States has a private healthcare system until you get to be 65, and then it goes to Medicare, which is more of a quote-unquote socialized system. I don't think socialized is the right word, but for this conversation, that's what I'm going to use. And that care that is delivered results in the most number of bankruptcies of any category of bankruptcy. It results in horrible rationing of care because people simply can't afford it. Whether you have private insurance or not, you might have a $10,000 deductible plus pay $1,500 a month before your insurance even kicks in. And so people don't go to the doctor, they don't do preventative medicine, they don't do all the things they need to do to stay healthy. And then you have a whole system that is based upon treating disease, because disease is enormously profitable. From medical schools that spend an enormous amount of time teaching pharmacy and nothing about teaching diet and exercise and mental and spiritual health. Whether you're talking about pharmaceutical companies that just jack up the prices every year because what's the public going to do? Are they going to not take the medicine? They're going to die? So they keep jacking them up. From corporations who are in the quote-unquote healthcare industry to help with health, they're not about that. They're about doing the bottom line. Every part of our system, from start to finish, is focusing on death care, on disease care. And the patients. Look at our country. We are the most obese nation in the world. And that obesity leads to horrible outcomes and extremely expensive care. And so what they are doing is they're not focusing on prevention. They're not focusing on health care. They're focusing on, I'm just going to abuse my body until I need a lot of disease care. And so I named this universal death care because, in my opinion, that's what we have in this country. It's care that's focused on disease. The entire industry, from patient to the doctor and everything in between, is focused on disease. And that is not sustainable. It's not sustainable from a perspective of living to your potential, because we all know if you don't have health, you don't have anything. You could be a billionaire and bedridden, can't get out of bed, and what is that money going to do for you? So from an individual perspective or potential, from a societal perspective or potential, we are not living up to what we could be. And we're doing that because we're entitled. We all think that we're due health and vitality and a long life, no matter what we do. No matter if we smoke, if we're obese, if we haven't exercised in 5 years, fill in the blank. And so the system that we have in America right now is universal death care in the age of entitlement. Now this book is a solution too. And the primary solution too is to become educated. Know where we stand as a country on healthcare. Know where you stand as a person, as a patient with your own health. Become educated on the issues and then vote and hold your politicians accountable so that we can get to a state that works better for everyone.
You know, Reagan, as you and I were talking about your book, and as I was reading your book, I was struck by the very, very stark, eloquent, disturbing scenarios that you drew about your experiences in combat. I think people reading the book are going to be very surprised at the things that you have to say that you went through, that your patients went through, that your Marines went through, that innocent Iraqi civilians went through in wartime. But even though that's very compelling and it's very important for people, especially people that have never been to any kind of combat, to be able to read and experience vicariously through that reading what you experienced, how does that really relate to care, civilian care, in a civilian society in America?
So that's kind of chapter 1. And yeah, the stories are gripping and they're compelling, and sometimes they're very hard to go through or read through. They were hard to live through. But about a month ago, I had a ruptured appendix. So I went to the ER and I was in pain. I was in a lot of pain because I had sat on it. I thought I could walk it off. You know, the Marine in me said, oh, just walk it off. Well, it turns out you can't walk off a ruptured appendix. And so I'm in there and I'm being poked and prodded and CT scanned and all these things. And then I'm being rushed off to surgery. Now, that experience in that cold bed, in that cold room, with your life completely in somebody else's hands, you have really little to no control over, is very similar to being dropped off in Iraq in a helicopter in the middle of a combat zone and being shot at. Yeah, bullets weren't flying at me, but bacteria and infection was filling my gut and was trying to take my life. And so I think both situations are kind of extreme. Flying into Iraq, going to war, and your appendix bursting and having your belly being consumed with infection trying to kill you. And you're out of control in both scenarios. And that's what we have to realize. People who are listening to this have to realize that at some point, you've either gone through it, you're going through it, or it's coming around. And you will need health care in perhaps an extreme fashion. And you will have no control over that. And that will be a life-altering event. Now, when I was in Iraq and landed in that field and dust was everywhere and I lost my way, well, very similar to being in a hospital bed, very confused, going into septic shock, about to die, and having somebody cut my belly open to try to save my life.
Yeah, but surely, Reagan, in the hospital here in the United States of America, surely there was a team of very competent professionals. Surely their medical training, the pharmaceutical industry, the insurance companies, surely all of those people were working on your behalf, right?
Yeah, I do believe that they were working on my behalf, just like I believe when I finally got to Recon Battalion and they welcomed me there, that we were all a team marching forward in a common direction. We didn't know what the future held in Iraq for any of us. When I woke up from that surgical bed and I got my wits about me and I was walking down the hall, my thought was, okay, I'm relatively young, very healthy except for what just happened, and now I need to recover. I have a good job and I have good insurance. What about the people who don't? What about the vast majority of Americans who have high deductible plans with not very good benefits and do not have, and let's be honest, do not have a physician's salary? As they're walking down the hall trying to recover and in pain, tubes out of themselves everywhere, how many of them are thinking, can I afford this? Will I be able to afford my mortgage and this? Or will I be one of the huge numbers who are going to go into bankruptcy because of medical bills, because they're out of control? The analogy between Iraq and healthcare in America breaks down at some point. But there's enough commonalities that I think if people see the uncertainty in Iraq and the uncertainty when they need medical care in America and how much is completely out of their control when they're in that vulnerable position, I think they'll be able to draw the parallel.
Well, would you agree that the people that make healthcare policy, the insurance companies that determine what they will or will not reimburse physicians for or patients for, the pharmaceutical companies, would you agree that they all have really your best interest at heart?
No, I think the physicians do. I think the medical professionals do, the nurses, everybody that goes into the care, actual physical care. Everybody else is making money. And that's okay. We live in a capitalist society, and I think capitalism, for the most part, when it has some checks and balances, reasonable checks and balances, I think that's the best way to approach most things. The problem is that, for pharmaceutical companies, they released a thing a couple of years ago, I write about it in the book, that talks about, well, as long as you only increase your prices by about 10% a year, then that's a reasonable increase. Why? Why is that reasonable when inflation's 1% to 2%? Why is it reasonable when, if a medication's been out for 20 years, all of your research and development costs are covered, and it's enormously inexpensive to produce medications? Why is just 10% a year reasonable? And then there's lots of examples where pharmaceutical companies have increased their prices 1,000% over the last couple of years. 1,000! When all the research and development have been covered, manufacturers gotten cheaper because it's been out longer, fill in the blanks, it's turned generic, all these things, and even generic. Now the generic companies realize, and oftentimes cost more than the branded drugs because they're playing the game. What are you going to do? You're going to die? You remember the EpiPen thing, where they just kept jacking up the price for EpiPen. And EpiPen is a medication that you deliver if you're going into an asthmatic attack so you don't die. It delivers epinephrine to you. Well, they just kept jacking up the price and jacking up the price. Because what are you going to do? You're going to let your kid die? And so the insurance companies, the pharmaceutical companies, all of these big industry, their mission is to make money, not health.
One of the things that I was struck by in the book, one of the many things actually, was your description about once you left combat in Iraq, once you separated from the military and opened up your own clinic seeing civilian patients, that you discovered that you were once again in a conflict which in its extreme could be deadly for the patient. I'm very curious to understand how you can equate moving from a combat situation, the conflict there, the deadly conflict there, with your statement that healthcare in America is in such disarray that is also a conflict, potentially deadly conflict, that you have to confront every single day with your patients.
So in Iraq, I never fired my weapon. When I was being shot at, I was always treating the wounded or preparing to treat the wounded. So while I had a shotgun on me and a 9mm pistol and knives and all sorts of other things, I never killed anybody in Iraq. I was a cog in the wheel of the war machine. My being there meant that in some way, shape, or form, I allowed what happened, the good, the bad, and the ugly, in Iraq to take place. I still have some moral injury on that because there's some horrendous things that happen in war. Sometimes war you have to enter into. Sometimes to stop somebody like Hitler, you simply have to do it. And you have to blitzkrieg it and just destroy and deal with the carnage afterwards. There are some wars that are necessary. I will not use the word just, but necessary to stop an evil that is greater than war. And there are some wars like Iraq that, in my opinion, were not needed. Other solutions could have been had. And I feel a certain amount of responsibility because I believe that if you do not accept responsibility, that you'll never get to a solution. So I accept some responsibility for being at a war that I do not think was necessary or just. And I was a part of that. In America, I'm a physician. Every day I try my best to help people. I try my best regardless of all the external forces that are trying to get me not to help them. Insurance companies don't want to pay for a cancer surgery. Insurance companies don't want to pay for the right medication. Insurance companies want to deny care as much as often. That's why they have prior authorizations. Prior authorization, if I want to write a medication, then I have to ask somebody who is not a physician, not a nurse, has no medical background at some insurance company, if I have permission to write an insurance. That's what I went to medical school for. That's what I went to residency for. That's what I spend and dedicate my life to knowing the right medication, and I'm held to the standard of care. Why in the world is it legal to have these prior authorizations that people just look up on a form and say, nope, that one costs too much money. You're not going to be able to do it, Dr. Anderson. And the insurance companies, they say it's to have checks and balances on the doctors to make sure that we are practicing appropriate medicine and to safeguard the patient. That is the biggest lie, the biggest, I won't say the other words that I'm thinking. That's what a doctor is. All they're trying to do is save money. And that's what the entire system is trying to do. Save money so that their corporations can make more money, not take care of the patient. And I'm a healthcare provider. So just like in Iraq, where I was a doctor trying to treat people in war and never fired my weapon, I'm a healthcare provider in this country, trying to do my best for my patients, regardless of all the other corporations and outside influences that are just trying to make money. And because I'm part of this, I'm complicit in what they're doing. And again, if you do not consider yourself part of the problem, you will never consider yourself part of the solution. So right now, I'm naming myself as part of the problem because I am part of the system. That's why I'm writing this book, trying to get people involved, trying to get people to realize that what they are fighting against might not be war and bullets and bombs, but what they are fighting against is an entire system that is not designed to keep them healthy, and it's not designed to treat them the best way possible. It's trying to treat them the cheapest way possible so they can make more money, and it has to stop. We have to start focusing on health, not disease. And that's from the patient perspective as well as the industry and government perspective. Everybody needs to stop focusing on death care or disease care and start focusing on health care or prevention, doing our part so that we don't need as much medicine in the future. So that when we do need medicine, it is abundantly available for all of us.
So Reagan, over the years, you and I have had several discussions about many topics to include politics and bureaucracy and what it takes for meaningful change to occur. You've been very eloquent so far in your description of the American healthcare system in what it is failing in. But I would like you to now give us some examples of what you would actually change in the healthcare system in America.
First thing I would change about healthcare in America is I would ask people to get educated. I love this country. I think it's the best country on the planet. I think it is the light for all nations. But that doesn't mean we're perfect. It doesn't mean that we don't have things that need to be improved upon. And I think healthcare is one of those things that we can do much better on. So people need to get educated because most of the people listening to this also have similar warm associations of America, of it being a great country. And we automatically assume that we are the best at everything. It's American pride. I get that. You raised me for that. I mean, your father was military. My other grandfather was military. You were military. I'm military. My biologic mom was a diplomat in the State Department. I mean, our family is as much about service to this great country as you could possibly be. But that doesn't mean we're the best at everything. And I need people to get educated. I need people, the first thing is always education. Know what you're talking about. Don't just say, hey, I'm a Republican, so I don't believe in universal health care, or hey, I'm a Democrat, so I do believe in universal health care. Healthcare is not a partisan issue. Health is not partisan. I promise you, this might be a stretch, but I promise you get Nancy Pelosi and Donald Trump in a room and ask them, is being individually healthy important? I think even those two could agree, maybe, I don't know. But it's not a partisan issue. Being healthy is a human need. And in order to become healthy, we have to be educated on how to make ourselves healthy individually and societally. So guys, please, whoever's listening to this, whatever you think on if universal health care is good, bad, or indifferent, full stop. Read the book. Do your own individual research. Don't just trust me because I'm a doctor and whatever. Do your own research. Look to see how we compare with other countries. You'll be blown away and disgusted. In fact, the first couple of articles you read, you'll think that it's some sort of, leftward-leaning nonsense that, CNN has sponsored or CNBC or whatever. It's not. We have some of the worst health outcomes of any developed nation on almost every measurable outcome you could have. So, what's the first thing? What do we need to do? We need to get educated. Now, after you're educated, after you know where we stand, where other countries stand, then please put aside if you're a Republican, put aside if you're a Democrat. Leave those out of it. It is not a partisan issue. Ask yourself what makes sense individually, societally, fiscally, with sustainability, all of those things. Ask yourself those questions. What is your role? And then move forward. And part of your role in this great democracy, in this light to the world, is to vote for politicians who can carry out what you think after you've thoughtfully considered your point of view after you've become educated. Because we get the politicians that we deserve. We get the politicians we vote for. And if we don't hold them accountable, then they can do whatever they want. They can take democracy hostage. And the last thing I'll say about that is our culture in this country about not hearing the other person's point of view and just yelling at them, telling them they're stupid, and then saying, now believe what I think. When we do that, when we can't have conversations, you and I have had a very healthy, I think, debate on, Reagan, are you really complicit in the war machine? My answer is yes. I believe your answer was no. But we spoke about it respectfully. I heard your point of view. I tempered my point of view because of your point of view. But if I just yelled at you and said, listen, retired Lieutenant Colonel Anderson, you're stupid, you're dumb, my point of view is the right way, how are we ever going to have a conversation? How am I ever going to learn and grow? And that's what we're doing. We're yelling at each other on social media. We're yelling at each other on the news. We're yelling at each other in person. We're ignoring each other. We're calling them names. Our politicians are doing it. The news people are doing it. Everybody's doing it. And when we are divided as a nation, when we can't have a conversation with each other respectfully, consider the other person's point of view. Don't listen just to argue. Listen to understand. And then once you understand, then once you're educated, then offer your point of view. If we don't do that, then the politicians and the corporations have all the power. They've taken democracy hostage, and they make all the rules. Right now, the news is making all the rules. The lobbyists are buying all the laws. The politicians are squabbling with each other over what's going to help the left or the right succeed, not what's best for the country, and we all know it. Become educated. That means talking to people and listening. Vote your conscience. After you become educated, after you've spoken to people, hold them accountable. That's the first thing that we have to do.
My hope is that those that need to hear this the most will actually hear it. I particularly like your comment that lobbyists and politicians and the news media are basically holding the whole country hostage. Unfortunately, it seems to me more and more that more and more of our society is geared to not only not listen to anybody but their own side, but for some reason, they seem to need to be told what to think. And that's something that I think is dangerous. And I think you'd agree that when you were growing up, that was one of the big things. Think for yourself. Don't be told what to think by somebody else.
That was a constant message, is you have to think, Reagan. And in order to think, you have to be educated. In order to be educated, you have to listen. Yeah. Like it's the lessons you taught me my whole life. But as I get older and as more of the lobbyists and the news media and all that stuff start squabbling, I think the recipe that was valid when I was 5 years old is even more important now.
Well, I concur. I believe that as well. Moving on to a different area, a recurrent theme in the book is the need for people to take responsibility for their own health and actually to be penalized in terms of medical costs to themselves if they don't take care of themselves. But Reagan, saying all that, aren't you really discriminating against people that just don't believe in the same kind of health regimen that you do? And how does that square with your idea of the fact that health, if we have a birthright, it is to health, and everybody deserves to be able to have access to good health care? So again, are you walking that line of sort of discriminating against those that do not take care of themselves?
Well, let me answer that question with a question. If I were to set up a car insurance system where you are responsible for the car next to you, whether they speed or don't speed, and you're held accountable for that, is that fair?
No.
Okay, so if you're driving, speed limit's 55, and you're going 55, and the car races by you at 70 miles an hour, you don't think you should be held accountable for that 70 mile an hour.
Correct.
Right? Why?
Because it's not me doing it, it's they are doing it. If they get a ticket or have a wreck, it's on them, not on me.
Okay. Well, the healthcare system in America is set up like that right now. So somewhere between 50 and 85% of all healthcare dollars that are spent, the real number is probably in the upper 60s. But listen to this, somewhere between 50 and 85% of all healthcare dollars spent in America are spent treating 4 enormously preventable diseases that all stem from basically being obese and not exercising. So when you turn 65 in this country, you go on Medicare. It's a government system. It's a quote unquote socialized system. I don't really like that term, but I'll use it here. Now, when you get older, you consume more healthcare dollars. We all know that. You get more sick, you need hospital stays, you need all sorts of things. So you've abused your life for your entire life. Usually you don't have too many complications until after 60, 65 when it's on the government's dime. You're obese, you smoke, yada, yada. Don't take care of yourself. And now you're consuming public tax dollars to do that. So basically, it's the car scenario. That person's been driving at 70 their whole life. Well, you've been driving at 55. But now you, because you've taken care of yourself, you have to pay more for their health care. Right now, Medicare is going to be bankrupt by 2030. And that is probably extremely optimistic. It's probably 5 years earlier. By 2050, 1/3 of this country is going to be diabetic from obesity. Our poor health statistics are skyrocketing. The healthiest 50% of the population consume 3% of all healthcare dollars spent. The healthiest 50, the people driving 55 miles an hour, consume 3%. So right now, we have car insurance gone sideways. The car insurance you didn't want, because you're being asked to cover everybody else's expenses. Now, listen, if you have a genetic condition that you need lots of health care, that should not count against you. If you have some sort of outside cause that is contributing to your health that is not under your control, that shouldn't penalize you either. We have to take care of those people in an abundant fashion. But if you're just wrecking your body with obesity and lack of exercise and lack of good mental health and lack of good food and all these sorts of things, then that should not be on me to cover you at the expense of bankrupting and corrupting the whole system. It's not fair. It's not just. We have to penalize people when they're young and making bad healthcare decisions, so they feel the pain now monetarily, to influence them to live healthfully, to live to their potential, so that they don't drain all the resources in society, so that when they get to be 65, they're not consuming way more than their fair share. And as a country whose obesity rates are horrendous, where way more people are overweight or obese than they are the proper weight, you can't have an entire system that's sustainable survive when the vast majority need way more care than they've ever contributed to paying for.
Well, in the book, you have some specific, very interesting examples of how you would actually do that.
Right.
Why don't you go ahead and relay some of those now?
Sure. So the basic thing is be accountable now for the actions that are going to cost more later. So have a Medicare for all who want it system. If they want to stick with private carriers, stick with private carriers. If you want to sign up for Medicare, then sign up for Medicare. And your rates would double. One, they would double for the care that you're getting now, and then for the care later. So they're not really doubling, you're just paying for care now. Now, if you're paying for care now and you're healthy, it's going to be very low. And your future costs are going to be very low too because you're healthy. You're taking care of yourself. Now I'm talking about 4 things that you can control, not genetic conditions or things that are outside of your control. So just double your FICA tax, your Medicare tax now, and that'll give you healthcare now and in the future. But if you want Medicare now and you want Medicare in the future and you're obese and not taking care of yourself, well, if you want the Medicare for all, then you're going to pay 2 or 3 times the fees now. And if you want it in the future when you're 65, you're going to pay 2 or 3 times that amount in the future to cover the costs that you personally will incur. The moment you start living a healthy lifestyle, that's when your rates drop now and your rates drop in the future. So there's real-time penalties. Now, part of the system is we have to start educating better. So that means in grade school, in high school, in colleges, we need to educate people on how to stay healthy. We need to have abundant resources so that everybody in this country, no matter what socioeconomic background they come from, or what cultural background, or educational status, that they can get those resources for free, abundantly, so they know what they need to do. We also need to talk to the medical schools and make sure that the physicians, the nurse practitioners, the physician assistants, the nutritionalists, everybody starts focusing at least as much on prevention as they do disease care. Because right now, medical schools, I went to an osteopathic medical school, the founding school, and it's a great school. They spent less than 20 hours in 4 years talking about strict prevention for your mind, body, and spirit. Less than 20 hours. When I had thousands of hours on pharmacology and other disease treatments. So everybody has to be educated. And it has to be culturally relevant. And we also need to do things like passive public health policies to help everybody. Now I'm going to get a little nerdy here, but there's active policies like sign up for a health savings account and you'll be able to do tax-free, yada, yada. That's active. That requires me to do something. And then there's passive public health policies like putting fluoride in the water. You're going to drink water anyway. When you drink it, it's going to help your teeth. Whether you believe in fluoride or not, that's a side issue. We need lots of passive public health policies, which are harder to think of, harder to construct, because people in lower socioeconomic classes often don't have the luxury of figuring out that a HSA or health savings account even exists. So we need passive public health policies so that people who are just trying to survive, to pay their rent, to pay for food, that sort of thing, they can get healthier and get the care they need. We need to just change everything. And to start this whole question off, we have to penalize people now for things that are going to cost society an enormous amount of money later so that they can cover their own expenses. That's all I'm asking to do. I'm asking that person to cover their speeding ticket at 70 miles an hour, not asking me to cover their speeding ticket when I'm driving 55.
You've mentioned the importance of education several times, and I certainly concur with that. Right now, the world is concerned about this virus in China. And we all know that in our country, thanks to the anti-vaccination people, we are now seeing a resurgence of measles. What would you say to people listening about, specifically about the need to vaccinate, the need to be educated, the need to not be swayed by celebrities who have some idea based on basically nothing?
Well, there needs to be truth in advertising. There needs to be truth in media. We need to hold each other accountable on all aspects. So insurance companies and pharma and stuff, they're going to read this book and they're going to rip it apart. And they're going to rip it apart disingenuously because they don't have a leg to stand on. They really don't. They're just looking at their corporate bottom line. So we need to have some honesty. But in order for us to hold those people accountable, to hold the celebrities or to hold the anti-vaxxers accountable, each individual needs to take personal responsibility and know the facts. For the measles, the whole anti-vaccination thing started from quote-unquote scientists overseas who tried to draw a link between vaccination and autism. It came out a couple years later that they completely made up all of the data to become famous and rich. And they admitted it. They skewed the numbers, they skewed everything, so they could become famous and rich. Now, even though they've admitted that publicly, even though their doctor titles have been stripped, even though the repercussions have been very public and very available to figure out online, for some reason, people still like to hold on to that. Now, you're not going to be able to go to an anti-vaxxer and change their mind because they're not rational, reasonable people, because if they were, they would have looked at the data. You, as a responsible, reasonable individual, need to do the research for yourself. You might say, okay, Reagan, I already get vaccinated, I'm not an anti-vaxxer. Great, but why not? Are you just blindly trusting the establishment to say this is good? The establishment being me, the physicians? That's not good. You need to research. Get on Google. It literally will take you 2 minutes to research these things. Not by some quack writing in his mother's garage in Arkansas, by legitimate sources that can go through the data. Become educated. I don't need you to question everything, but I need you to question enough things so that you know what's happening. I get vaccinations because if you look at the data, more lives have been saved by vaccinations than all, underscore all, other medical interventions combined. Every cancer treatment, every heart surgery, every pill, more lives have been saved across the planet by vaccinations than every other medical intervention combined. Yes, they had some problems when they started. Will they have problems in the future? Yes. But from a risk-benefit ratio, it is enormous in the favor of getting vaccinations. Enormous.
So Reagan, under your system, what happened to the anti-vaxxers who arguably are not engaging in realistic preventive medicine?
They would have the right not to get vaccinated. Now, I understand that by them not getting vaccinated, they put us all at significant risk. It's called herd immunity, and they're hurting us all. But I also believe in individual rights and freedoms for you to decide what you're going to do with your own body, as long as you're not hurting somebody else. Now, the argument could be made that since they're not getting vaccinated, they are hurting other people because herd immunity is not happening. But I'm going to leave that aside. Under my system, if people didn't want to get vaccinated, they would just have to sign over that if they have complications from any of these diseases that they're going to get or could get because they're not getting vaccinated, that is 100% on them. The cost of treatment is 100% on them. It's kind of like the smoker who doesn't want to quit smoking. You don't have to have Medicare if you don't want it when you're 22 or 23. You can say, no, I don't want it. In fact, you can even write off later on in life saying, when I'm 65, I don't want it either. If you want to write off when you're 65 and not want it, you'll still pay your normal tax because you're part of this country for regular Medicare. But you then sign off all of your rights to healthcare after 65. It's all on you. So if people want rights and freedoms, my plan gives them more. You decide. Are you going to pay for everything yourself and hold yourself accountable? Then do it. If you want to keep smoking, keep smoking. If you want to stay in the system, you're going to pay more for that because it's going to cost more. If you want to get out of the system, you're out of the system. But then things like free emergency room care for everybody has to be treated, you're out of that as well. We have to start taking personal responsibility. And people are going to say, well, Reagan, if you do this, then, what happens when the person's 68 years old and they need medical care and they change their mind? Well, I'm sorry, they made their choice. In America, we feel like we're entitled for everything for free. We feel like everybody else should pay our burden. Those are not the ideals this great country was founded on. Our country was founded on representation, adequate representation. Right now, the healthy do not have adequate representation. And the unhealthy, due to selfish choices, are stripping the healthy of the health care that they need in the future because the system is collapsing. Personal responsibility. You don't want to get vaccinated? Fine. But whatever repercussions happen on that, that is on you, not on society.
Well, okay. What about innovation? In this country, partly because of all the money that is going into the pharmaceutical companies and the medical technology companies, we see a constant stream, increasingly rapid constant stream of innovations. What happens when that money arguably is not present any longer because the pharmaceutical companies and the insurance companies are not reaping their enormous profits that they are now if we operated under your suggested system?
So I love that question because it's trying to trap me. It's trying to say that I accept the premise of your question, and therefore, because I accept it, now I have to answer based on it. I don't accept your premise. There's a ton of money for innovation. Why do we pay more than twice the amount for prescriptions in America than for the exact same thing our Canadian brothers and sisters pay? Twice in this country. We do that because Congress, 15, 16 years ago, decided, because of lobbyist influences, that Medicare, the government, could not price negotiate medications. That's why we pay more. I promise you, they're still making a ton of money up in Canada, but they're paying half. See, in America, our lobbyists have positioned themselves to buy the politicians' votes to increase their profitability at the expense of the health and the financial health of every American out here. So they could get reelected, so that they could have bargaining power, however it happened. Billions and billions of dollars spent. There is an enormous amount of profit to still be had in a capitalist system where greed is controlled.
Okay. I'd like to get back into the guts of your book. And I want to read something which I think is a particularly powerful passage. And then I'm going to ask you to discuss that in terms of healthcare in America. Here it is. The scene is the makeshift surgical suite at Camp Fallujah, where an 11-year-old Iraqi girl has been shot, and medics are desperately trying to save her life in the midst of combat, and without many of the tools one would normally find in an American surgical center. Here is your passage. Quote, "Even today, that scene is vivid in my memory, and it has helped shape my conviction that medicine must be about providing the best possible medical care as and when needed, and not be driven by greed or hobbled by bureaucracy or manipulated by attorneys. That day in that makeshift surgical center, medical personnel did everything in their power to save that child, and nothing else in the world mattered. Contrast that with American veterans who today, in the USA, cannot get adequate treatment for the physical, emotional, psychological, and spiritual wounds they suffered doing the job their country called on them to do. Because of government red tape, frequently capricious decisions by non-medical clerks and insurance companies, or litigation, that drives doctors to practice defensive medicine to try and protect themselves from lawsuit. In Iraq, in a war, in substandard conditions, an Iraqi child's life was all that mattered. There was a time in the USA when that was also the prime directive in medical care. That time has come and gone. We need to get it back. So Reagan, equate that for me and for the listeners and the viewers to healthcare in America.
It's a hard story. And the parallel is a little strained. But that 11-year-old girl, all we cared about was taking care of her. We didn't care about profits. We didn't care about politics. We didn't care that she was Iraqi. When a provider is treating a patient, I don't care where they are, first do no harm. Take care of the patient. You know, there's doctors out there that say the biggest problem with healthcare in America is that physicians do what's right for the patient. They need to do what's right for society, meaning rationing care, saying, hey, you're too old for this, or hey, you're too this for that. That's not our job. Our job is to take care of the person. But we can't be blind to the circumstances that happen after the care. We can't be blind that if we write a medication that they can't afford it because something that costs $2 to produce is $500 to buy. We can't be blind that bankruptcy could happen from any treatment we give them because insurance is so bad in this country. We can't be blind to all the things that are compounding against the patient and against their health for their mind, body, and spirit. We have to gather around that table as a united, cohesive front. That includes corporations, that includes government, that includes the providers, that includes the patient. We all have to gather around for health, sustainable health, not health that's going to put them out of their house and home and not be able to provide for their children. And as passionately as I am about that story of that 11-year-old girl, I am as passionate about that as I am about healthcare in this country being completely broken, and that we need to refocus on health. Yes, profits are important, but that is not the focus. Health is. Yes, all these other innovation and everything else that we need to do, it's important. But health for the patient needs to be of paramount importance. That 11-year-old girl lived. She went through a living hell, but she lived because we united. At the end of the day, there were forces outside of our control, and she most likely died in the system in Iraq. If we have that same situation in America, where all the providers who've dedicated their lives to helping people keep the patient alive, but months later end up killing them in some way, shape, or form, either financially or spiritually or fill in the blank, then what good did we really do for that patient? The whole system needs to change so that as the providers are gathered around to save a life, to bring health, to bring a potential, when they leave the office or leave the hospital, they can still thrive. They can still have the ability to pursue life, liberty, and the pursuit of happiness. Right now, no matter what I do, when a patient leaves, the system is so broken. A lot of times I wonder if I did them any favors.
The universal health care that you are championing in the book and in your life sounds a lot like Medicare for all. And a lot of people just don't believe that that's economically sustainable, and they are concerned that that could lead to rationing of health services. You seem to state, in fact, you do state in the book, that rationing is already occurring on many levels. Could you explain that a little bit?
Sure. You have a $10,000 deductible. You pay $1,500 a month for that. At the end of the year, you've paid $20,000, $25,000, $30,000 before insurance even kicks in. How likely are you going to go to the doctor when you need to, or are you going to push it off as long as you can because you know that the first $25,000 is out of your pocket? And how many families in America can afford that? And as deductibles are increasing every year, and as insurance rates are increasing every year, the people listening to this podcast, you might say, oh, I'm okay, I have a decent job. But for how long? If they keep increasing at the rates they do, if your insurance doubles, like it basically has in the last 10 years, for out-of-pocket costs for you, in 10 years, if it doubles again, how comfortable are you going to be? When will you get the care you need? Or it will be the last resort when it's too late, and disease care becomes even more the norm. Yet universal health care, Medicare for all, it will break as the system is right now. If we continue to leave the corporations unchecked, continue to leave the pharmaceutical industries unchecked, continue to not focus on prevention, continue to not be healthy, continue our path of entitlement, of greed, of warmongering, if you will, as it applies to healthcare, Medicare for all will not be sustainable. But right now, Medicare for just 65 and over is not sustainable. Our system is collapsing. We need a complete overhaul, which means we all have to get educated, and then we have to vote our conscience. But you are 100% right. Having a Medicare for all who want it right now will completely bankrupt the system, just like the system's heading over the cliff right now. Everything needs to change.
You draw quite a few parallels in the book between the mind-numbing attributes of combat, of war, and the mind-numbing results of how healthcare policy has been established and is executed in the country. And by that I mean healthcare policy all the way from politicians in Washington who, by the way, many times don't have to live under the same rules that you and I have to live under for medical care, and the insurance companies and the malpractice suits, which I want to get to in a minute. How, in your opinion, does all that kind of conspire against I'll call it a rational healthcare policy in this country?
It doesn't. Oh, how does it conspire? Everything conspires with each other. It doesn't work. I mean, I think that says it all. Nothing is working. Politicians, under the ACA, the Affordable Care Act, politicians, the Republicans went to the Democrats and say, okay, we'll sign off on this if you take the same insurance. The Democrats went, whoa, no, this is good enough for the country, but not good enough for me and my family. I remember watching the press conference where they announced that the ACA passed. And Obama just looked like he got beat up. And Biden was back in the back whispering a classic Biden quote, which I can't mention, but that the microphone picked up. And Obama looked like he got beat up. And it was a big blanking deal, to quote Biden, but he looked like he got beat up for this big blanking deal because he didn't get what he knew he needed. He had control of the House, the Senate, and the presidency. And the corporations were too powerful to pass something that Obama thought would get us where we needed to be. It was a watered down version. Now, I'm not saying his version would have fixed all the problems. I'm just saying that corporations have so much power and money. The lobbyists have so much influence. And the politicians pander to whatever they want to pander to instead of doing what's right for the country. And that's our fault. That's the citizens' fault because we voted them in, all of them. We've allowed the system to be what it is. Everything has to change. We need comprehensive reform starting from grade school to the end of life. And every institution in between, every profession in between, every patient in between, it all has to change.
Reagan, I want to switch to something that is now very personal, and I believe for many listeners and viewers of this interview will also be very, very personal. And I want to read to you the question that I wrote down because I want to get all the words in so you can give a complete response. In addition to your call for an enlightened approach to healthcare, you speak eloquently and powerfully about your struggles with PTSD. Because PTSD has wreaked such havoc in so many lives, and because you fought your way out of the worst effects of your own PTSD, please give us the bottom line of what you did and are still doing and what you learned, so that readers of your book who are also fighting their way through PTSD, or who are living with someone who is struggling with their PTSD demons, might get some insight and some hope that this pernicious disease can be controlled. So, Reagan, speak to the viewers and the readers about PTSD.
Sure. So as you know, I'm a decorated combat veteran with Marine Recon, 2 tours in Iraq, and it shook my core. When I was in Iraq, I was okay. But when you come back to America, I remember curling up in a ball in my closet during the first 4th of July because the percussion of the fireworks were reminding me or bringing me back to Iraq. Now, people with PTSD don't remember the trauma. They relive the trauma because our brains haven't processed what has happened enough to remember it. So our bodies relive it physically. We are there physically. I had some hallucinations. I had all of that sort of stuff, auditory, visual, and I had my body with adrenaline rushes and all that sort of stuff. So as somebody with PTSD is reliving the experience, I eventually got to the point where I realized this is ridiculous. I'm back in America. I am not in Iraq. And I physically made myself stop and notice the beauty of this great country and the safety that we're afforded here. And then I made myself feel what I was reliving and then contrast that with reality. I went back to Iraq, here, and in my body. So in my head and in my body. I did it over and over and over again, hundreds and hundreds and hundreds of times. The first time it took, the first time it took me about 60 minutes to get through it all. Now I process it in less than 1 second when something makes me relive it. That was step 1. Step 2 was then anticipating the triggers that would make me relive the experience and then have a plan to combat it. So then I started thinking about the things that could actually happen: a slammed door, a loud noise, a car wreck, a gunfire. And then I started saying, okay, when this happens, this will happen. Over and over and over again. So I had a plan. First, I based it on reality. Then I had a plan. Then the next step, and these all took a year or 2 each. The next step was then to visualize my day going differently. Realize that I have control over my destiny, not something that happened years ago. My destiny is my choosing, and I choose to live here. So every day I go through a routine. I do visualization, exercises. Some people might call it meditation. Some people might call it prayer. I don't care what you call it, but I have a path that my life will go on because I owe it to society, to my wife, to my patients, to not be stuck in Iraq. And coincidentally, it's the same thing I'm asking people to do in the book. Have reality, get educated, have a plan, talk to people, figure it out for yourselves, and then daily do the things for yourself and for this country that need to happen to get us in the right direction. People can look at me and say, Reagan, you're skinny, you've always been skinny. Yeah, it's true. I don't understand what an obese person has to face to lose weight because I've kept myself healthy my entire life. When my brain wasn't healthy from Iraq, it took me some years. I had some lessons learned, but now that has been overcome. So while I don't understand getting over obesity, I do understand mental illness, at least the one I went through. And it's the same steps as I'm asking people to go through when they're considering healthcare personally and for this great country.
So Reagan, we've covered quite a bit in this discussion about your book. There's a whole lot more in the book, of course, than we could possibly get into an interview of this length. My perception after reading the book is that it is a book of hope. There's a lot of lot of writing in the book about things that aren't working and why they aren't working. But I found the book to be one of hope. Hope that people can learn to think. Hope that people can be energized, be activated to hold their politicians accountable and not let them, as you put it, pander to whomever they need to pander to on any given day of the week just to get reelected. Hope that the medical system can be reformed, and hope for those people that are suffering through the mental, psychological, physical effects of war, that there's hope that they also can find their way through that darkness and back into the light so they can live a life unencumbered, and so the people that love them can share in that as well. So having said that, what's your bottom line today that you want to impart to the readers and viewers of this?
The power is yours. The power is yours to change everything, personally and for this country. And if you want healthcare in the future, you need to start getting involved. You are intelligent. You are capable. Stop listening to the voices that are saying that this is a partisan issue. Stop listening to the people who say this is too big to tackle. And you take control. I do not want a system like the Veterans Administration where everybody's just shoved far, far away and don't get the care that they need. I need a system that's held accountable from start to finish. And you're right, it is hope. What made this country great? Democracy. It was people standing up and saying enough. They stood up to an oppressive power and said enough. We need life, liberty, and the pursuit of happiness. Of the people, by the people, for the people. Pretty sure that revolution was a little bit bigger deal than healthcare. And I'm pretty sure that blood courses through you, and it definitely courses through me. Take control of it. It's only when we, the people, stand up and say enough that it will happen. And I know it's in our blood. I know it's in our DNA. We just have to get educated and get involved.
Okay, Reagan, thank you.
Thanks, Dad.